Welcome, everyone. Welcome back. Good afternoon. Uh, this is our Health Equity and Social Justice and Vulnerable Populations ECHO Clinic by the Hispanic Center of Excellence at Rutgers, New Jersey Medical School. My name is Luis Alzate Duque. I'm an assistant professor of internal medicine and pediatrics, and I'll be facilitating today's ECHO session. Also here with me today is our panel, our hub, and my colleagues, and they're going to do just a quick introduction. Dr. Soto-Green.
Welcome, everyone. I'm Executive Vice Dean at New Jersey Medical School and internist, and delighted that you're here with us today.
Victor.
Hi, everyone. I'm Victor Cueto. I'm an assistant professor of medicine and pediatrics here at New Jersey Medical School, and I'm really excited that everyone's joined us.
Vivian.
Good afternoon, everyone. My name is Vivian Cueto, and I'm with the Office of Primary Care and Community Initiatives here at NJMS. Thank you all for joining us.
And I'm going to kick it back to our ECHO team, Amy.
Good afternoon, everyone. My name is Amy. I'm one of the program administrators with Rutgers Project ECHO. Just a few program reminders for everyone today. If you are joining us today for the first time, Project ECHO is a globally recognized educational program that builds learning communities to share expertise and problem-solve patient and client situations. We encourage you to change your screen name to display your name so we're able to know who you are. Please use your video if you're able to. Seeing your faces helps us connect with each other. Please join the conversation, ask questions, offer your own recommendations at any time by using the chat box feature. Given the increased usage of Zoom around the world, we want to make sure that everyone is comfortable within our community. Our purpose is to ensure a collaborative, safe space for all of our participants. Let us know via the chat if you hear anything or see anything during the call that you feel is not appropriate. We appreciate you keeping our ECHO a safe space for all. As a reminder, since you have registered for this session, you do not need to register again for the upcoming sessions. We encourage you to save the Zoom connection information and add that to your calendars if you haven't done so already. We will be sharing links throughout the presentation and access to the recording for you after the session. The series is approved for continuing education credits. In order to receive your credits, you must complete the post-session survey for each session that you attend. The continuing education credits will be awarded at the conclusion of the series in June. And just a reminder, this series is eligible for physician, CME, nursing, CNE, pharmacy, CPE, and social work credits. We would also love for you to submit any questions or present a patient scenario during one of our upcoming sessions. We will share a link to our question submission form in the chat. And as you may have seen in our welcome slideshow, we are able to offer some incentives to our participants. Anyone who does present a case or a patient scenario during one of our sessions is eligible to receive a $30 Amazon gift card after the completion of their survey. And we also want to reward our participants for regular participation. So if you do complete at least 6 sessions with us, we will send you a survey and you're also eligible for a $30 Amazon gift card. Before we get started with today's session, just a couple more reminders. We always want to be HIPAA compliant when you speak. Please introduce yourself, be respectful and supportive of one another. And again, we are going to be showing Spanish subtitles at the bottom of our didactic presentation. And most importantly, as always, have fun and enjoy the session. Today, we would like to do a brief poll to everyone on the line just to get a sense of your profession. So Teresa, our program coordinator, is going to go ahead and launch that poll. If you could just take a second to answer that for us, that would be great.
So I just want to acknowledge that we have a very disciplinary team in our audience. Uh, and I think the beauty of this space is the fact that we can share in our knowledge, but also learn from different fields. So your interaction would be immensely appreciated. Our goal with the series is really to provide a little bit of education, but also learn from community providers to sort of better understand how these social determinants affect health. Um, we're going to explore strategies and techniques to reduce unconscious bias, structural racism, and improve access to healthcare, and together, improve the impact on vulnerable communities. I just want to remind everyone the session is being recorded, and I want to extend a thank you to all of you for participating. And I want to say that I'm very honored to introduce our guest speaker. I have had the privilege of working with her, for the past 3 years and learned from her. And I hope that some of that shines through today. Today's topic and didactic is titled The Importance of Language in the Context of COVID-19. It's going to be presented by Dr. Pamela Valera. Dr. Pamela Valera is a social worker by training. She is a certified tobacco treatment specialist, faculty in the Department of Urban Global Public Health, and serves as the director for doctoral studies at the School of Public Health, wears very many hats and does all of them wonderfully. And this is at Rutgers University, the State University of New Jersey. She received a Bachelor's of Arts degree in psychology from the University of San Francisco. And her Ph.D., and her MSW from the University of Michigan, and her Ph.D. from social work at University of South Carolina. In addition to her academic background, Dr. Valera completed a postdoctoral research fellowship in HIV prevention and human sexuality at the Columbia University, and clinical training in cancer disparities from the Albert Einstein College of Medicine. Dr. Valera's clinical work and research programs focus on addressing health disparities in marginalized groups, including people living with HIV, those who are at risk for HIV, and people involved in the criminal justice system. And so I'd like to open the floor for Dr. Valera.
Thank you, Luis, for that introduction, for that warm introduction. The title of my presentation today is The Importance of Language in the Context of COVID-19. Amy, could you advance the slide? I have no actual or potential conflicts of interest in relation to this presentation. The agenda and the learning objectives. So we're going to talk about key definitions. What is language? What is literacy? Why are we, wanting to understand language, the implications of that, the social factors that impact COVID-19, why is language important in the context of COVID-19, and some best practices when we consider language as we start to think about how to address COVID-19 in our populations that we serve. So some key definitions. So language is a system of communication which consists of sounds, written words, and gestures used by people for talking or writing. Amy, next slide, please. And so the definition of health literacy is to the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Now, I wanted to provide basic understanding of what language is and what health literacy is, how health literacy is defined. And that way we have a common definition for those two terms, because I will be using these two terms throughout the entire presentation. Amy, next slide, please. So why does language matter? Well, language matters a lot. It matters when we communicate about health. Words also matter, and it's especially important when it comes to personal topics about health. And I just wanted to note that global public communication is conducted only through a small number of world's languages. When we think about, COVID and the issues related to COVID and vaccines and so forth, how are information about COVID transmitted? And while there are 5,000 to 6,000 languages, according to Wikipedia, the World Health Organization makes information available in only 6 official languages. And these are Arabic, Chinese, English, French, Russian, and Spanish. And 3 additional languages include German, Hindi, Portuguese. But I want everyone to note that English predominates and is a key language in record. And it's important to understand that because we are experiencing a multilingual crisis when we're trying to inform the communities that we serve, our loved ones, indigenous populations. And so the heavily reliance on English as the only public health linguistic language is really problematic. And so I wanted to just speak on that. And next slide, please. And while language can be used to motivate, it also can be used to create fear and panic. And so we're going to do a quick exercise. So I want to give you the opportunity to experience or remember what it feels like to struggle when you're reading information. I want you to read the following paragraph. Next slide, please. Just read it aloud, together or separately, and I'm going to give you a minute to do this. And just a little hint is that the words are written backwards. So take a moment right now and just try to read the following paragraph aloud, either together or separately. So we'll give you about a minute to do that. Let's begin.
Is anyone brave enough to read this out loud?
Any volunteers?
I can try.
Thank you, Sylvia.
To assure high performance, periodically clean the tape heads and capstan whenever you notice an accumulation of dust and brown red oxide particles. Use a cotton swab moistened with isopropyl alcohol. Be sure no alcohol touches the rubber parts as it tends to dry and eventually crack the rubber. Use a damp cloth or sponge to clean the cabinet. A mild soap like dishwashing detergent will help remove grease or oil.
Bravo. Next slide, please. Thank you, Sylvia. So how did that make you feel? Did you know what to do, Sylvia? How did that make you feel, asking you to read aloud the paragraph?
Well, so it did feel pressure and made me feel a little like incompetent. And I was worried about, what people were going to think. It certainly helped when you said that the words were written backwards. That helped me right away to orient myself to what I needed to be looking for.
Did you know what you were reading?
Eventually I realized I was reading instructions on how to clean something.
Right. So for others, how did you feel?
So I'll share that I had a preview of this, and I read it at another point. And what struck me pretty hard was the fact that I had a very hard time reading it. But then when I thought about really comprehending what I was reading, it was very difficult. So I can't imagine for someone that has lower literacy, or where the instructions are not at their appropriate level, how it would be extremely difficult to really comprehend what is it that they just read.
What got in the way, or what was difficult about reading this paragraph?
It's just
Right.
not a normal way to read. We read from left to right with the letters, and it was right to left, so it was not normal to me.
That's one, yes. So that's a really important note, and I'm loving the conversations in the chat. I think someone noted that, you know, it was good to experience that everyone feels like they're together, just, you know, we're all on the same boat, but sometimes we're not on the same boat. So please, next slide. So this has serious implications for all of us, because nearly 9 out of 10 US adults have difficulty using the everyday health information that is routinely available in our healthcare facilities, retail outlets, media, and communities. And so I just want to take a step back and sort of, you know, reflect on this. You know, given your earlier experience in reading the paragraph, and now knowing that, you know, majority of our population really have difficulty, what do you guys think about this?
And then I know there were a few comments on the chat. If anyone would like to elaborate how maybe this would translate to a patient population. So Roseanne, I know you said you had to think totally differently and move your eyes differently. Leonore acknowledged that the letters were backwards. Sarah acknowledged that it did make her feel better knowing that they were all on the same boat. I'm not sure if anyone wants to elaborate.
Hi, this is Stacy. It just makes me think of my clients who are uncertain of, I work with first-time mothers, so during their pregnancy up until the child is 2 years old. And I will have clients who I'll ask them questions about their different tests, let's say gestational diabetes. And one client's like, no, I don't have it, but I just pinched my finger. So it's definitely a missing of information. And it also translates into not following protocol guidelines because they don't know them. It wasn't explained correctly to them.
Exactly. Okay, thank you. Next slide, please.
Oh.
Natalie, did you have something to add?
I'm sorry. I was just going to say that as healthcare professionals, I think it's important that if you have somebody that speaks a different language or they're not familiar with the medical terminology, we should be mindful of that and give them more time to process what we're saying and to maybe explain it in a different way. There's translator material available as well. I know in my ICU, I do have a language app on there where we can FaceTime translators that could be helpful in communicating that information. So I think it's just something that we have to pay attention to. And you know, in healthcare, we're very busy, but we do have to take that time.
Exactly. And, you know, when we think about, you know, what's happening in our society, you know, and in the context of COVID-19, we also have to consider the social factors that impact understanding information related to, you know, decision-making, safety as it relates to COVID-19. So COVID-19 has expanded our long-standing structural drivers of health inequities. And so what are these factors that contribute to these structural drivers? It's education. It's we assume that our clients, our patients have some education to understand the information that they're provided. We expect that, that they understand our dominant language, which is English. And we take to consideration that our culture is sort of the right way. And, we also have to think about, that information provided to a 4-year-old is very different compared to someone who is in their 60s. So, and then income, income drives a lot of the decision-making that our patients and clients and family members participate in. And so these are the key structural determinants that have contributed to the impact of COVID-19, and I'm sure there's others. But and language is one of the I'm pioneering problems as we start to navigate these the information, the massive information that people are provided from social media to their local public health authorities to to even ourselves. So next slide, please. So why is language important in the context of COVID-19? And as I said earlier, we are hearing a lot of new health terms and phrases that we may not know. And many of us are at risk for experiencing COVID-19 and are also struggling to understand, navigate the healthcare system. And it's also important, it is important that health information is easy to understand, so we know how to protect ourselves and we should seek care. And health literacy approaches may help us understand and act on health information that we receive. And I just wanted to highlight that we are also part of the communities that we're serving. And so I try to limit the othering. So when I hear information about health, I always think back to my mom, who only has a 3rd grade education. And I say, will she understand what these health terms mean? How do I explain it to her in plain language that she could understand? She's multilingual. And so how do I explain it to her in multiple languages that maybe she can understand the terms and then make appropriate actions? And so it's about all of us. It's about the we-ness. It's less on othering and using the term they. It's us. We are all impacted by COVID, and we're experiencing it together, but we're all dealing with the aftermath and the current issues very differently. And so I just wanted to sort of emphasize the togetherness of COVID and also the implications of our language. Next slide, please. So I'm going to spend a few slides on scientific babble, I guess. So this was an article by the New York Times. It was about flattening the COVID. So how would you explain this flattening the coronavirus curve to your patients? This is how the New York Times explained it to the public. So how would we try to explain it to our populations that we work with?
Would anyone care to share their thoughts about this curve? Is it something that's understandable, clear? How would you explain it?
Does it even resonate with you?
I mean, for me, it resonates because I'm used to looking at graphs like these, but the way that I would explain it to my patients is, in order to prevent the spread of infection, we need to protect ourselves and others by washing our hands, by wearing masks, by not being very close together in small quarters, So basically just basic infection control measures that I would try and explain to them in a way that they would understand.
So doing more explanation of
True.
measures to protect themselves.
Right. And everybody is a different learner too. You know, I'm a clinical nurse educator, so some people are more visual, some people are more hands-on, auditory. So I would assess what method works for them first.
The remaining slides will focus on best practices. And previously I talked about the need to avoid the othering. So using the we to engage our patients, our clients to the conversation, knowing that, you know, I'm also impacted by the health condition and by COVID, for example. And so it provides that safe space where the client or the patient can share their concerns. Use first person language, and that means, you know, avoid stigmatizing language where, you know, I use people who are incarcerated, people who are in detention facilities, as opposed to incarcerated people. I think it's really important to sort of separate the stigma from the individual. We also need to understand the importance of culture. We all come from very diverse cultures, and, you know, by using first person language, by avoiding othering, we can learn more about our patients in that fashion. The other best practice is that, you know, we want to avoid war metaphors, and you're seeing this a lot in the media. You know, the frontline corona warriors that you're seeing, you know, CNN, New York Times, you know, calling us as warriors and so forth. Because what happens with that is that when you have, you know, in a war metaphor, there has to be an enemy. There has to be someone else to attack. And as you can see, what's happening now and how we use, you know, stigmatizing language to, you know, to connote corona. You know, we, in the past, you know, unfortunately, our former president called it the China virus, the Wuhan virus. And then you can see how there are populations.
Can we use the vaccine?
Populations that are, you know, impacted by that, you know, they're being attacked and harmed and so forth. You want to be able to synthesize information in plain language. This is the exercise that we talked about earlier, where, you know, a lot of us didn't even quite understand what we were, you know, reading. So how do you synthesize all this information that we're getting from all different types of sectors in plain language? And science communication in preferred languages. That's really important. It's that we can't expect that everyone knows and understands English. We need to make sure that we have, we distribute information that is plain and understandable in our clients and populations' preferred language. We want to limit medical jargon, and the next coming slides, I'll talk about more about what that looks like. And, you know, I love using analogies or diagrams and pictures to explain what I'm trying to say. So it's really important to do that. And we want to avoid, like, you know, 2 pages of information, because that's a lot for people to digest. So keep text short and simple, and you want to define terms, which I'll talk more about later. Next slide, please. So here are some, you know, medical language that we, you know, in the medical and health field are aware of, but our patients and clients may not. So use plain non-medical language. So instead of anti-inflammatory, for example, another way of saying that it helps swelling go away. Instead of using the term benign, like benign cancer, you can say something very simple, it's not cancer. Instead of contraception, you know, maybe using birth control, oral, you know, another way to say that is by mouth. Diet, another way to say that is what you eat. So I have these two words here, monitor. How could we say that in a non-medical language, like in a very plain and simple way?
Look at.
Yep.
I like
What
that.
about, go ahead.
I would think, watch out for or look for or
So the other term is do not resuscitate order, and this is becoming very, yes, keep an eye on, excellent. This is becoming very common as we have, like, I had a family member who passed away from COVID, and we had to do a do not resuscitate order, and my mother-in-law didn't know what that meant. So how would we say that's differently? In a simple, humane way.
I think what I would think of would be somebody put it in the chat, allow a natural death, and I think that is
It's beautiful.
the best description that there can be for that.
What else? What else can we use instead of DNR?
And maybe Natalie, may I invite you to talk a little bit about allowing the natural death and why that's important to phrase it that way?
I love that. Let's die peacefully.
Am I unmuted?
Yes.
Can you hear me? Okay. Yeah, so we used to use the term do not resuscitate or DNR, but I guess the term resuscitate could be confusing to some people. So just to say allow natural death is more of a layman's term to call it, instead of doing life-saving measures. We're just going to keep the patient comfortable is what we say. And then, we try to explain to them, doing CPR, like pounding on the patient's chest can be hurtful, and it probably will not help at this point. So we try to make them understand that we're just going to keep them comfortable and allow them to die naturally.
Thank you for sharing, Natalie.
Sure.
Next slide. And really, this is very relevant as we continue to experience and deal with COVID. Is first and foremost, do no harm. And we know exactly from either personal, professional, or from what the media is sharing with us, what has happened to using terms like the Wuhan virus or the China virus. People are getting hurt and getting killed because of that. And so instead of Wuhan virus, we're now using SARS-CoV-2, the new coronavirus. Instead of quarantine means something's different in the correctional community. So when you quarantine, what that means for us is that you basically are in your cell 24/7. You can't leave, you have to be monitored. And quarantine does not mean just 14 days. It means, weeks, months, or even a year until the warden or the superintendent tells you that it's okay to leave your cell. So another way of saying quarantine could be, let's just separate, let's be in the other room. And then instead of saying infected with, because as you know, in some cases, being infected with COVID or being infected with HIV has stigma attached to it. So instead of infected with, we use affected by. And I try to limit the term they, because again, that's another way of othering people. I say we, especially if you're part of that community and you have been, involved and exposed to those issues. Social distancing, instead of saying that, and we use this a lot, we assume that people know what that means. It's, a simple way is don't get too close to people. So how would we, instead of using new variant, what could we say differently?
A new type of COVID-19.
Mhm. So a new type, yep. What about vaccine? Thank you, Melissa. What about vaccine? How could we say, instead of vaccine, what words can we use to explain the same thing? A shot, yep. Exactly. Immunization. Great. Next slide. So the as I said earlier in my best practices slide is that we may want to consider defining our terms. I'm not sure whether contact tracing was actually defined when it was first introduced to us. So, you know, in a very simple way, contact tracing, this is a way to identify people who have or may have been around a person who is sick. So just a personal note, my mom ended up getting COVID, and a contact tracer called her, and she thought she was getting evicted from her apartment because she ended up because of COVID. And so she hung up. She was so scared. And she didn't know what contact tracing meant. And the contact tracer called my father. And again, my father was like, don't talk to me, talk to my wife. So again, we want to help our clients, our patients understand these terms that we're using. And even the term coronavirus has been used so often these days. Like, we expect that our patients or clients know what this term, but let's not, you know, let's just define it for them. So it's a group of germs that cause people to get sick. Next slide. And so again, another way to help our clients and our patients to, you know, understand our terms is to use images, and, you know, to ensure that our infograph includes their preferred language. So an image is a very good way to explain the different parts of the body as it relates to symptoms. Next slide. And I have a video, I have the link, and, you know, I think Victor will share that. So what this is that it's a short video that we created to help the Latino community who speaks Spanish to understand what they need to do to protect themselves, or the measures to protect themselves from COVID. And it's very simple. We have subtitles in English as well, but we have images, and we really walk them through sort of what COVID is. Next slide. And then this is an image from the FDA, again, using just images, you know, making sure that your infograph or your campaign is culturally appropriate. It's uses plain, you know, just very simple text. You know, you want to make sure that that you're using the best practices as well as you start to develop these images and so forth as it relates to what your public campaign related to COVID. And next slide. So I just want to end with this closing quote. What I hear, I forget. What I see, I remember. But what I do, I understand. And that all of these things, you know, we hear things, but, you know, immediately we can forget. It's the application of trying to understand these things. So if there's a way to apply what we know in a very basic, simplified way, we can ensure that our clients and our patients, or the people that we love, can practice what we're asking them to do as it relates to COVID-19. So that is my last slide. And I have some references here, some resources. So I just want to open it up for discussion.
Thank you so much, Dr. Valera, for that great presentation. I think a few key points to highlight would be acknowledging best practice, use of simple language, use of imaging. And what I found important was how the images really reflected the culture they were trying to target. So honoring or acknowledging the importance of culture within, you know, the form of communication that we're trying to achieve. So I just wanted to open it up to any comments, questions.
Catherine has raised her hand.
I think you're
There you
muted.
go. Yes.
we can hear you now.
Okay. Sorry, great. I really loved the exercise, but something strange jumped out at me in the comments chat when somebody did say, and I'm sorry, my background's all weird. Somebody said that, you know, oh, it's great. I don't feel alone. And I felt that way too. But then what struck me as interesting as I had a conversation earlier this morning with some folks about some myths about the vaccine. And it occurred to me that oh yeah, it's nice to listen to other people who feel the same way I do and are uncomfortable with this. And in that same way, that could have a negative effect, because if people are like, oh, well, I heard this myth and so did you, and we're going to talk about it, and we're going to feel, and that's the way some of that misinformation spreads, because people who understand something the same way you understand it, it just expounds on that. And so it was sort of a weird offshoot of what you shared that made me realize how those myths can persist.
Mm-hmm. Thank you for sharing.
Yeah, and to expand on that, sometimes we don't even realize these things, and it's these exercises that help us make that realization. For me, it was the comment on contact tracing. And I think Vivian shared a comment about undocumented individuals. And I thought that was so important, because I do feel the term contract tracing was not explained very well in the media, but it was widely used. And for a population that's vulnerable, or hidden populations, or populations that may not want to be engaged or have fear of engagement with the medical community, a term like that, or an action like that, where you're having people reach out to them, call them, ask information about other people who they've been in contact with. If it's not explained clearly and in a simple language, it can really have some devastating effects.
Any other comments from the group?
I think the one thing when we met as a group in preparing was a comment about frustration. So I was curious, when you began to read something like this, how much frustration was actually triggered. And then the other is, how we tend to insist, that people need to be able to communicate in the primacy of the language of English, right? And how often we continue to still hear that today through our various learners on, this is America and therefore. So I'm just curious what the group feels, and have you experienced it, and what have you done?
I think that's an excellent point, Dr. Soto Green. I think there's also this shame. Folks are ashamed that they may not be able to communicate either, because of a language barrier, or, they're hard of hearing. They have low literacy, low health literacy. So it's often something that, patients will confide in, after something is highlighted that wasn't understood. They're often, ashamed to have not having understood that. So I think it's on us to also have a welcoming environment for patients where, things can be discussed and folks are able to express that they're having a hard time understanding.
Yeah, and as a social worker, we're trained to reflect back and ask a lot of questions, not just, do you understand me? Because people will always say yes, even if they don't. It's like, yes, yes. And then, you realize that they didn't really understand anything you said. So it's really about taking the time to, and explain in a way that people can really get to, step 2 and step 3 and step 4, and making sure that we're available to our patients, our clients, when they do have questions, and that they, because there's this power authority, right? Where we are considered the authority, so we know everything, and there's always that imbalance of power. And so I I have my, my clients call me by my first name. Oh, please just call me Pamela. It's definitely okay. Call me Pam, whatever you feel that's comfortable. So we try to, I try to make sure that the space is warming and inviting. And I always say, so, tell me more. It's a really good way of elicit new information, so, how did you get here? Like, tell me how you got here, because sometimes when our patients are coming to our visits, they've already experienced a lot of issues getting to where we need to go. But, so I think just really taking the time and not assuming, I think the main thing is not assuming that our clients, our patients know exactly what we're saying, because even all of us have trouble understanding what the latest new information is for COVID or for how you monitor your own medication and so forth. And so we always have to make sure that, that we get the, that we're asking a lot of questions that is helpful.
Laura, I love the comment you posted on the importance of acknowledging language. And I'm sorry I'm putting you in the spot, but if you could share how that has changed your practice, sort of acknowledging language from your staff and others and your clients, and yeah, if you could speak on that.
Oh, okay, you unmuted me. Good. I just like to say it out loud because this is like a personal thing for me that I get really mad. That people are like, why can't they speak English, or why can't they know the language? I just feel it's so like ignorant. I'm like, are you kidding? They already know more than you do, and they've just arrived here. Are you kidding? So I really like to point out that that's a huge strength. Like, maybe, you've only gone to school, like traditional school, for like 1 to 2 years, but the amount of learning that you have really helps me. And I don't think you should ever minimize that or have it be taken away from somebody. You can get a job so many ways by having it like on a piece of paper, but if you don't have the skills to like work it out, and someone who is like communicating in another way, or like showed me a really great drawing of this or that, or a different way to explain something. I've used the language line many, many times in my work. And I like to ask this question, how it sounds to me, but ask it different ways just to make sure I'm getting the information correct, because it's easier. It might seem like more work for you as the provider in the beginning, I guess, but the truth of the matter is you're actually saving yourself work and frustration by doing that little bit extra. And I think it's just kind of like a continual practice shifting your thought process. But I always like to say it out loud, just in case someone forgot that when they're with me, if they're seeing another patient or a client.
And Laura, to your point, I mean, I've been in situations where in patient encounters where I've needed to use that translation line, or I'm speaking with someone and I need some assistance, and the patient or the client is confused by what the translator is saying.
Yeah.
And so I love your point of asking the same question differently, so that way you can get more information and sort of arrive to a logical and accurate description. Thank you for sharing.
Because there's just so many different things. I think even like with certain particular items, how you're talking about vaccine, like shot or pinch, like it could be a picture shot that they're thinking of, or a pinch could mean something very painful, or it could mean, I don't know, I could think that it could mean like a pinch could mean like someone tickling you when, and then I give them a shot that is a tickle and it doesn't feel that way. So, I just like to be maybe overly verbose because I just think like it's not worth my livelihood. It's not worth my license. It's not worth harming the client.
Absolutely. I think that's a great point. Laura is really doing, no harm, right? And elevating the safety, and, trying to have the air, even if you're talking more. And we're actually going to have a session specifically on interpretation. But I think to Dr. Valera's talk here, language is something we encounter, written, verbal, and otherwise throughout the path of interacting with anything. And in healthcare, it becomes that much more difficult because of health literacy, because of the way that we show messages, the way that Dr. Valera highlighted in her talk. And so I always borrow a term, and I shared it in the chat, from design thinking, which is thinking about the journey of the patient, right? From the second that they pull up to the parking lot or pull up to the front of the building, all the way through the end. And there are multiple stumbling blocks with language and with communication along that journey, and we need to think about it. Each of us have different health systems, different people that interact with the folks along their journey, and so each of those folks needs to be mindful of this.
And Stacy, thank you so much for that comment on, and I'm just going to read it because I think it's important. Our explanations must be respectful with the focus on explaining appropriately until the clients understand. And I think that really should be driving the discussion, is a respectful understanding of where clients are and how do we help them understand. It's our responsibility to show them the information that we need them to know. Does anyone have any other comments?
I think Natalie was raising her hand.
There we go. Actually, it's interesting about acknowledging the journey of how the patient got there too. I was recently at a conference, and there was a gynecologist that was talking about how he was trying to get one of his patients to come in for an appointment. And she actually approached him and said, well, actually, I did try and come to an appointment a few weeks ago, but I had to take 2 buses to get there. And unfortunately, one of the buses was late and I was 15 minutes late to the appointment. And because of your policy for being late, I was turned away. So hearing that story, he actually changed his policy because he was trying to get this patient in and he had no idea of those, social determinants that were affecting her to come in. So I think that it's important to assess the whole person and what they're going through and the challenges that they face.
Absolutely. I think we need to meet our clients, our patients where they are, not expect them to adjust to where we are.
And just to add to that, we do our best to adjust to the provider. The appointments are very set in stone. There's only limited time. So we do our best to reschedule things, cancel appointments that have been made. So I love the idea of, meeting in the middle and figuring out through dialogue and communication, what is the best appropriate path. Because we as patients, clients, providers, when we're dealing with these things, making a lot of adjustments to make sure that we can meet our doctor at that time, because that is the only time available, because the next appointment is in 3 months or in 6 months. So just to add to that.
And we are up to our time right now. It's 12:58. I just wanted to make sure I thank everyone for staying with us. I thank Dr. Valera for being part of this ECHO and sharing some of your expertise. I'm very thankful and glad that we have such a multidisciplinary team here. And by team, I am including the audience. And thank you for your engagement and your comments. I'd like to pass it on to Dr. Soto Green. I'm not sure if you want to give any closing remarks for today.
No, I just want to thank all of you for just simply caring. I think your presence means a lot to all of us. And this is something, again, that it really comes from the heart while we receive funding to be able to carry this out, through the CARES Act. Thank you for everything that you do each and every day. And we continue to learn as much from one another. And so we look forward to your continued participation, and we'll be all stronger and we'll be refortified, right, by the end of this to continue our journeys. But thank you again.
And in the form of announcements, I just want to make you all aware our next ECHO clinic will be April 16th. We'll be presenting, our presenter will be Dr. Victor Cueto. And he will be presenting on Say What, Improving Quality of Care for Populations with Limited English Proficiency. So as you can see, we're sort of building a thread. Thank you so much all, and have a great day.
Thank you, everyone.
Thank you.
Take care, everyone.
Stay safe.